Hello and welcome to the final instalment of this series of podcasts on medicine through time. And this final podcast is going to focus on public health. And you should already be identifying those strands of change and continuity right across the ages from Roman to modern day, if you've listened to the entire series. And this podcast, like all the other four podcasts that I have taken you through, is going to look at how public health changed and continued from the Romans right through to modern day, and consider those factors that are actually causing that change, whether that be progressive, so positive, or regressive, negative change, or in some cases continuity, which is quite a common theme. And as I say, consider those factors that are causing that. So let's begin. We're going to begin our podcast today at the start of our time period, which is the Roman era. Now, because the Romans had such a strong system of government, and just one system of government that controlled all of their territory, Britain obviously was controlled from Rome and had an authority figure within Britain who was sending out the messages that Rome directed. Now, this led to great public health improvements within Britain. Most notably, Roman Britain had clean water and sewerage for those people that lived in its towns. And therefore, people stood a much better chance of living longer because of this. So why? Why did the Romans bother with public health, particularly in territories which were so far away? The reason behind this is because the Romans saw the importance of keeping all of their citizens healthy, whether they be soldiers, whether they be traders, whether they be just general workers, farmers. It was important that everybody stayed healthy so that the empire could remain fed and also could prosper and be the best that it could possibly be. Now, they noticed that disease came from bad smells, swamps, so they avoided building their towns near to any swamps. And they believed that this was because, obviously, of the bad smells. Now, we obviously know today that it wouldn't be down to the bad smell, it would have been due to the dirt and bacteria coming from those swamps, the mosquitoes, etc. But that was the first provision that you can identify from government, them encouraging their armies, their new territories, to build their towns and cities away from those swamps. They also identified that dirt seemed to cause disease, and although they couldn't explain this, they heavily encouraged hygiene amongst their citizens to encourage that healthy lifestyle. And that came from the importance of having building aqueducts, which brought fresh water from out of the towns and cities into the cities so that people could access that fresh water through fountains and wells. Secondly, sewers were established. Sometimes these were open sewers and didn't work as effectively as they could, particularly in hot weather because there wasn't any rainwater causing the sewers to flow. But there were clear attempts for waste to be completely separate to bathing water and also drinking water. Finally, one of the most famous things the Romans brought to Britain was their baths. These were excellent environments, not just to keep people clean, but they also encouraged a generally healthy lifestyle. They were social places where people could talk and discuss, therefore improving mental health. Exercise to improve the fitness of the individual. Exercise would be done, only light exercise, before they would actually enter the baths. They would then have oil spread on their body and scraped off to make sure that they were then clean before entering the baths for hygiene purposes. And finally, medical reasons. Many people believe that by going to the baths, the bath water actually contained healing properties. So there was many reasons why the baths were so important, and they were kept cheap so that many people from all walks of society could access those baths. And finally, government passed laws to make sure that the streets were kept clean and penalties were given to those who did not abide by them. So there are varying factors in causing public health in the Roman era to be so good. So the army and war, making sure that their soldiers are kept clean and hygienic to maintain their authority in their territories. Communication, because the empire was so vast, new ideas could be spread across the empire. Finally, government intervention, that strong authority, making sure that in those towns and cities there is adequate provision for public health, and it being of utmost importance on the government priorities list. It is important to note, though, and I have repeated towns and cities many times, those who lived in the countryside in Roman Britain did not benefit from these public health facilities. And it is important to note that things like waste would be dumped into the rivers within the countryside, and there would be water facilities there that could be contaminated within the countryside. Now, as we've heard in all the previous podcasts throughout the Dark Ages, after the Roman Empire actually breaks down, we see a disintegration of those towns and cities due to warring tribes. And this obviously causes a fundamental breakdown in public health facilities. This war destroys the towns and therefore the public health facilities, and public health facilities are not maintained. So in the Dark Ages, we see serious regression in public health. But there isn't really any public health facilities, any laws passed during the Dark Ages by local tribes leaders, due to there not really being any sort of central government there. Their main priority for leaders at that time in the Dark Ages was to gain more land and protect the land that they have, not the public health of their tribespeople, the people within their communities. Now, as you know, at the end of the Dark Ages, we see the rise of the church, the Christian church. And as a result of that rise in the Christian church, we start to see communities coming together and towns growing, trade growing. And as towns grew in the Middle Ages, it started to cause serious hygiene issues. People did notice, as disease started to spread in these towns, there was a link between dirt and illness, but they couldn't explain it. And due to a lack of government interest on sort of the whole, to be honest, they weren't that interested in public health. They prioritised it very low down. It was difficult to actually keep towns clean. Government intervention, when it was there, tended to be reactionary to diseases, rather than actually putting things in place to prevent spread of illness like the Romans did. There were seriously big issues that sort of indicate that medieval public health was not good. There was a severe lack of clean water. Toilets tended to be built over rivers where people would go to get their water. People could go to water cellars in which to buy fresh water, but often this was not clean either. So many drank ale as their source of liquid to keep themselves hydrated. There was no means of sewerage during this time, and if there was a means of sewerage, it was very ineffective. Butchered animals tended to just be thrown into the streets, their remains. This encouraged rats, and as we know, the fleas were on the rats, which then caused the plague, therefore causing public outbreaks. This isn't to say, though, that there was no public health at all in the medieval era. And if you had a question asking you how much change was there from the Romans to the medieval era, yes, certainly you would have to address there was serious regression from the Romans to the Dark Ages, but actually by the time you get to the medieval period, there is still some public health in place, or starting to be put into place once again. The rich had generally good hygiene. They had private latrines. This, though, in all honesty, is not technically public health. It is private provision because they are wealthy. Monasteries had fresh water systems. Once again, though, this isn't directed from government and technically is more private provision than public health. Although the monasteries did share that fresh water with the poor, the sick, who came to their facility to gain care. There were examples of some cities seeing the importance of fresh water, and you saw local sort of town councils trying to put pipe systems in place, lead pipe systems in place for clean water, like in London and Southampton. The problem with this, though, was that the lead would poison the water, causing deaths, and they weren't always reliable piping systems and tended to leak. There were also stewers, which were a form of baths which they took from the Roman era. The only issue was that they weren't generally cleaned out, the water wasn't, and people would literally come into the baths, step into the stewer, and just sit there, so it would fester in their own dirt. Whereas in the Roman era, the baths were very much clean. You would be cleaned before you got into them. And finally, there were gong farmers, people who went round and cleared up waste from the streets. The government did pass laws to prevent waste, particularly in times of disease, but largely the problem was there wasn't anywhere for this waste to go. So as a result, it tended to just build up again after the initial flurry of interest in trying to enforce the law. Now, as we move into the Renaissance, we see, like in the medieval period, towns growing even more. And London actually grows to a population of nearly 100,000 during the Renaissance. And this only increases the problem. Some public health attempts were made similar to that in the medieval era. Local authorities paid for water pipes, latrines for the rich, stewers, gong farmers, so all very similar. So therefore showing mostly continuity from the medieval period to the Renaissance. And this was once again largely down to the government's attitude towards public health. They didn't prioritise it. And therefore, as a result, you tended to see their interests being more reactionary to the outbreak rather than trying to prevent it. A good example of this would be the Great Plague of 1665. The government did intervene once the outbreak had happened, even though they had seen plagues like this before. They had not put anything in place to try and actually prevent it. So the government did intervene once it had happened, so they were reacting to the plague. They passed laws to try and contain that disease. They closed theatres, killed cats and dogs in the street. They burned tar in the street. And carts were sent out daily to collect the bodies. Most of this, though, was ineffective, as it was too late. It had already started, and they didn't really understand how to act, what was causing the disease. So they effectively had to ride it out. So we see once again that the factor of government intervention here, attitudes and beliefs at the time, lack of understanding towards what's causing illness, is heavily affecting public health facilities here. Now, we do start to see a slight shift in the importance that the government pay towards public health during 1750 to 1900. And this was largely because killer diseases actually increased during this industrial revolutionary time. And this was down to the fact that London grew, cities like London grew even more drastically, with London having 1 million inhabitants by the mid-1800s. The most terrible of these sort of diseases was cholera, which first hit in 1831. And most threats, like the plague, were sort of not very effective. People didn't treat it effectively. The government was still being quite reactionary at the start of this period. And it's not until we start to see individuals like Edwin Chadwick, John Snow come along, pushing and emphasising the importance of public health to the government, that we start to see change. So I'm going to now talk through some of these individuals and what they did in the 1850s to cause and bring about change in public health and really push to the government that something needed to happen. So we'll begin with Edwin Chadwick. Now, Edwin Chadwick was head of the Poor Law Commission, which was in charge of all the poorhouses in the UK. He did a survey of the working class conditions to work out how to try and reduce how much taxpayers' money was going into the workhouses. And in 1842 he wrote a report and he identified three quite scathing, critical things about British society. The first was the laissez-faire approach that the government took to public health. And he basically criticised them for this, as the government didn't believe that they should interfere in people's lives. The second was that the government believed that they shouldn't interfere in business. It was down to the individuals to be in charge of their workers and their conditions. And thirdly, people didn't want to pay to help the poor. These three things all showed quite a damning opinion of British society, not wanting to help or be willing to help their poor, their working classes, who were the backbone of the wealth of Britain at this time. He identified the problem really with taxes, and taxes being so high, was that people were ill due to the unsanitary conditions that they lived in. People who went to the workhouses tended to be the old, the weak, or people too ill to actually be able to work. And this was what was draining the taxpayers' money and having so many people go to workhouses. He offered a solution, and he said the solution was that people needed to have access to things, the basic things like clean water. They needed to be healthy, sewers needed to be in place, rubbish needed to be removed from their living environments, living conditions needed to be improved. And as a result of doing this, working class people would therefore not become ill. If they didn't become ill, they would therefore be able to work and would not be going into the workhouse. As a result, the workhouses' numbers would decrease, and therefore less taxpayers' money would be having to be spent. Now, as a result of this, the government did actually take action with the Public Health Act of 1848. This set up a General Board of Health with Chadwick as one of the three commissioners, so the people in charge effectively. The Act allowed, but importantly didn't force town councils to set up their own local board of health, appoint local medical officer, organise removal of rubbish, and build a sewer system. Now, only a third of the towns set up a board of health because they didn't have to. That's important here. They didn't have to with the 1848 Public Health Act. They didn't have to enforce this. Even fewer appointed a medical officer, and the Act was only temporary, and the General Board of Health was abolished 10 years later in 1858. But other individuals then got involved. We have individuals such as William Farr and John Snow, which I'm going to talk about now, who actually pushed and put even more pressure on the government and the public to change things. Now, William Farr studied the statistics on birth and deaths the government had been collecting since 1837. He published details of these death rates and causes in different places. This is an example of the importance of individuals and of science, sort of the scientific approach to solving problems of public health. So you've actually got two factors influencing here, in science as well as individuals. Now, as a result of him publishing these findings, this linked then in with John Snow's investigation of the Broad Street water pump, which showed that death rates varied according to where different water companies got their water from. Once again, example of individuals as well as science improving public health. Both of those highlighted to the government that areas that were deprived, areas which were unsanitary, were causing these epidemics like cholera, were causing these problems. But one of the big things that really pushed the government to take action was London's Great Stink in 1858. This literally put the problem under the nose of government. It persuaded the Metropolitan Board of Workers to build expensive new sewer systems so that the Thames would never stink as much again, and Parliament wouldn't have to be disbanded again because of the unsanitary conditions that were there. Now, in 1861, our big turning point, Louis Pasteur identifies the germ theory, and that identifies that disease was really spread by germs and unhygienic conditions. In 1867, most working class men in towns obtained the vote. All of these four things, so William Farr identifying death rates were down to unsanitary conditions in working class areas, John Snow identifying unsanitary conditions around water was causing high death rates in working class areas, the Great Stink in 1858, Louis Pasteur's discovery of the germ theory, and finally working class men getting the vote, all forced the government to have to introduce the Public Health Act of 1875. And this forced change made central government pass laws and local authorities funded and carried out change that improved the conditions, and they had to be done. There wasn't an option. So by 1875, local councils had to ensure clean water was provided, streets were paved, rubbish was collected, sewers were built, slum housing was demolished, and food in shops was of a good quality. All of which was the government finally starting to take onus for public health and the health of its people. And that was down to the individuals such as John Snow, Edwin Chadwick, Louis Pasteur, William Farr, down to science and scientific research, down to technology with the understanding of Louis Pasteur, and also the public's attitudes and beliefs having to be taken notice now that the working class people had a vote in elections. All of these factors contributed to an improvement in public health by the late 1900s. Not only did the government pass laws to improve the general public health and living conditions, more importantly, they also started to use laws to improve the individual health of people. And they did this by making, firstly, the smallpox vaccination in 1852 free to try and prevent outbreaks for the first time. And this is widened further in the later period by further vaccinations being given for free. All of this shows technology playing a huge role, engineering, individuals, massive influence on improving public health in between 1750 and 1900. Now, as we move into the 20th century, we see a continuation of this rapid progress and rapid change in public health. By the end of the 1800s, as we've identified, the government had taken onus for public health due to the factors mentioned. But also we see further change due to the factor of war. Now, at the end of the 1800s, the government is in a war in Africa known as the Boer War, and they are trying to recruit soldiers, and nearly a third of all the men who recruit as soldiers can't go to war because they are still not healthy enough. In combination with this, at the start of the 1900s, Rowntree, the owner of the sweet firm, and Booth both produced reports on working class conditions being unacceptable and death rates being too high as a result still. So as a result of this, a new government in 1906 known as the Liberals passed a series of laws over a 8-year period to try and improve the health of working class people further. Examples of this would be in 1906, free school meals are given. 1907, you have the school's medical service established, which meant that doctors would go into schools and would identify if there was an illness in a child. 1908 was the Old Age Pension Act. 1911 was the National Insurance. And from here there was a bit of a slowdown, but a slow but sure progression in government control over hospitals, with local authorities taking over hospitals between 1919 and 1939. And this came to a head post-war, the Second World War, with the NHS being established by Ewing Bevan in 1948, which gave free access to healthcare for everyone and took people, as it was sloganed, from cradle to grave. Now, obviously that was a big breakthrough, with people being cared for from that cradle to grave, including dental care, eyesight, and hospital provision being put in place for them. But prevention didn't just stop there, and since 1948 the government had taken more action to actually prevent people getting ill. Like in the 1800s, they were funding more vaccinations. You see polio in 1952, and further tests to be done, like cervical cancer in 2008. And other such tests, smear tests, and also bowel cancer tests post 50, all of which are examples and are funded by the government. Better disposal of rubbish and sewage, laws reducing air and water pollution, such as the 1956 Clean Air Act, laws improving health and safety at work, environmental health officers inspecting, laws to ensure health and safety assessments, risk assessments at schools and all other walks of life, all to make sure that the health of citizens is of paramount importance. And also, health education has grown since 1948. The government has funded posters, leaflets, advertisement to raise awareness of illnesses, and these have been a real success. For example, in the 1980s there was AIDS Don't Die of Ignorance campaign, which reduced the cases of HIV infections. Today there's the smoking campaigns to try and reduce the amount of smokers and to stop people from smoking. Laws have also been passed to influence people's behaviour and improve health, such as banning advertising of tobacco products, higher tax on cigarettes and alcohol, and banning smoking in public places more recently, all of which are examples of improved public health. So largely we see at the start of our time period in the Roman period effective, forward-thinking public health systems, although that isn't widely accessed by only people in towns and cities. We see massive regression after the Roman Empire leaves, with cities and towns breaking down and public health facilities being lost. That improves, though, during the medieval period, although not significant, not dramatic amounts, or not certainly to the level of the Romans. As we move into the Renaissance, we see a continuation of the level of public health from medieval to Renaissance, and we only start to see a real change really around the 1800s, when the government starts to take more interest, because it has to. Individuals are forcing government to take action, and they're forcing them and making their cases so clear through science, through technology, and the evidence that they're presenting. And then that only continues to improve more and more as we move into the 20th century, with the NHS almost being the cherry on the top of that public health provision. I hope you have found this useful, along with the other 4 podcasts which I've done. And if you do have any questions regarding this, you can either speak to me in class or email me at rbarber@world-school.org.uk. Thank you.